Neet PG Grand Test Set 8 Questions 176 to 200. Question 176. A patient presents with severe chest pain radiating to the back, unequal blood pressures in both arms, and widened mediastinum on X-ray. Most likely diagnosis? A. Acute myocardial infarction. B. Aortic dissection. C. Pulmonary embolism. D. Pericarditis. Answer. B. Aortic dissection. Explanation. Aortic dissection occurs due to a tear in the intima, often associated with hypertension or connective tissue disorders. Unequal pulses and widened mediastinum are classic clues. Question 177. A child presents with polyuria, polydipsia, hypernatremia, and dilute urine. Which test differentiates central from nephrogenic diabetes insipidus? A. Water deprivation test. B. Fasting glucose test. C. Serum osmolarity measurement. D. Urinary sodium measurement. Answer. A. Water deprivation test. Explanation. Water deprivation followed by desmopressin helps differentiate. Central D responds with urine concentration. Nephrogenic D does not. Question 178. Which antibiotic is contraindicated in children due to risk of teeth discoloration? A. Penicillin. B. Ciprofloxacin. C. Tetracycline. D. Azithromycin. Answer. C. Tetracycline. Explanation. Tetracyclines deposit in teeth and bone, causing discoloration and growth retardation in children. Question 179. In pregnancy, which antihypertensive is considered safest? A. Labetalol. B. ACE inhibitors. C. Atenolol. D. Verapamil. Answer. A. Labetalol. Explanation. Labetalol is commonly used for hypertension in pregnancy. ACE inhibitors are teratogenic. Question 180. The most common site of metastasis in prostate cancer is A. Lung. B. Liver. C. Bone. D. Brain. Answer. C. Bone. Explanation. Prostate cancer often metastasizes to axial skeleton, producing osteoblastic lesions visible on bone scan. Question 181. A patient develops sudden unilateral facial weakness including inability to close the eye and drooping of the mouth. Most likely nerve involved? A. Trigeminal nerve. B. Facial nerve. C. Glossopharyngeal nerve. D. Vagus nerve. Answer. B. Facial nerve. Explanation. Bell's palsy is due to facial nerve dysfunction, affecting both upper and lower face on the same side. Question 182. The most common cause of lower gastrointestinal bleeding in adults is A. Hemorrhoids. B. Diverticulosis. C. Colon cancer. D. Angiodysplasia. Answer. B. Diverticulosis. Explanation. Diverticular bleeding is painless and can cause significant hematochezia in older adults. Question 183. Which enzyme is deficient in Lesch-Nyhan syndrome? A. Adenosine deaminase. B. Hypoxanthine guanine phosphoribosyltransferase. C. Xanthine oxidase. D. Glucose choy phosphatase. Answer. B. Hypoxanthine guanine phosphoribosyltransferase. Explanation. HGPRT deficiency leads to hyperuricemia, neurological symptoms, and self-mutilation. Question 184. A patient presents with hyperpigmentation, hypotension, hypernatremia, and hyperkalemia. Which hormone is deficient? A. Cortisol. B. Aldosterone. C. Both cortisol and aldosterone. D. Epinephrine. Answer. C. Both cortisol and aldosterone. Explanation. Primary adrenal insufficiency affects both glucocorticoid and mineralocorticoid production. Question 185. Which of the following is an example of a Leib attenuated vaccine? A. Hepatitis B vaccine. B. BCG vaccine. C. Rabies vaccine inactivated. D. DPT vaccine. Answer. B. BCG vaccine. Explanation. BCG is a lead attenuated vaccine derived from Mycobacterium bovis. Question 186. A patient with COPD presents with worsening dyspnea, cough, and increased sputum. First line antibiotic choice? A. Amoxicillin clavulinate. B. Azithromycin. C. Ciprofloxacin. D. Doxycycline. Answer. A. Amoxicillin clavulinate. Explanation. Amoxicillin clavulinate covers common bacterial pathogens in acute COPD exacerbations. Question 187. Which condition shows string sign on barium meal X-ray? A. Achalasia cardia. B. Crohn's disease. C. Pyloric stenosis. D. Esophageal carcinoma. Answer. B. Crohn's disease. Explanation. String sign represents narrowed terminal ileum due to transmural inflammation in Crohn's disease. Question 188. Which immunoglobulin crosses the placenta? A. IgA. B. IgM. C. IgG. D. IgE. Answer. C. IgG. Explanation. IgG is the only antibody that crosses the placenta, providing passive immunity to the newborn. Question 189. Most common cause of meningitis in newborns is A. Neisseria meningitidis. B. Group B streptococcus. C. Listeria monocytogenes. D. E. coli. Answer. B. Group B streptococcus. Explanation. Group B streptococcus, Streptococcus agalactiae, is the leading cause of neonatal meningitis. Question 190. A 60-year-old male presents with painless Bro's hematuria. First investigation of choice? A. Urine cytology. B. Ultrasound abdomen. C. CT urogram. D. Cystoscopy. Answer. B. Ultrasound abdomen. Explanation. Ultrasound is a non-invasive initial test for hematuria. Cystoscopy follows if bladder pathology is suspected. Question 191. Which condition shows tram track calcification on CT scan? A. Sturge-Weber syndrome. B. Tuberous sclerosis. C. Neurofibromatosis type 1. D. Multiple sclerosis. Answer. A. Sturge-Weber syndrome. Explanation. Tram track calcifications are due to leptomeningeal angiomatosis in Sturge-Weber syndrome. Question 192. The most common cause of intestinal obstruction in children 2 to 10 years old is A. Volvulus. B. Intussusception. C. Hernia. D. Adhesions. Answer. B. Intussusception. Explanation. Intussusception presents with colicky pain, red currant jelly stools, and sausage-shaped abdominal mass. Question 193. Which vitamin deficiency causes scurvy? A. Vitamin A. B. Vitamin C. C. Vitamin D. D. Vitamin K. Answer. B. Vitamin C. Explanation. Vitamin C deficiency impairs collagen synthesis, causing bleeding gums, petechiae, and poor wound healing. Question 194. A patient presents with coarse facial features, macroglossia, and delayed bone age. Which hormone is likely deficient? A. Growth hormone. B. Thyroid hormone. C. Cortisol. D. Insulin. Answer. B. Thyroid hormone. Explanation. Congenital hypothyroidism causes these features. Early detection is crucial to prevent mental retardation. Question 195. Which organism is the most common cause of infective endocarditis in intravenous drug users? A. Streptococcus viridans. B. Staphylococcus aureus. C. Enterococcus faecalis. D. Pseudomonas aeruginosa. Answer. B. Staphylococcus aureus. Explanation. S. aureus infects normal and abnormal valves, commonly tricuspid valve in IV drug users. Question 196. Which part of the nephron is impermeable to water? A. Proximal convoluted tubule. B. Descending loop of Henle. C. Ascending loop of Henle. D. Collecting duct. Answer. C. Ascending loop of Henle. Explanation. The thick ascending limb actively reabsorbs sodium but is impermeable to water. Question 197. A child presents with cherry red spot on macula and hepatosplenomegaly. Which enzyme is deficient? A. Hexosaminidase A. B. Beta-glucocerebrosidase. C. Sphingomyelinase. D. Alpha-galactosidase A. Answer. C. Sphingomyelinase. Explanation. Niemann-Pick disease results from sphingomyelinase deficiency, causing lipid accumulation and neurodegeneration. Question 198. Which artery is most commonly involved in myocardial infarction? A. Right coronary artery. B. Left circumflex artery. C. Left anterior descending artery. D. Posterior descending artery. Answer. C. Left anterior descending artery. Explanation. LAD supplies the anterior wall and interventricular septum. It is the most frequent site of occlusion. Question 199. Which is the most common cause of secondary hypertension? A. Pheochromocytoma. B. Chronic kidney disease. C. Primary aldosteronism. D. Renal artery stenosis. Answer. D. Renal artery stenosis. Explanation. Renal artery stenosis, often due to atherosclerosis of fibromuscular dysplasia, activates RAS leading to hypertension. Question 200. A patient with myasthenia gravis presents with muscle weakness. Which drug is used for symptomatic treatment? A. Neostigmine. B. Diazepam. C. Phenytoin. D. Atropine. Answer. A. Neostigmine. Explanation. Neostigmine is an acetylcholinesterase inhibitor that increases acetylcholine at the neuromuscular junction, improving muscle strength.